are inside of this sitting room because today is the first press conference about the complicated illness that many people suffer in Africa. The first case was reported a month ago in Jambuku Mission Hospital in Zaire. The illness appeared near to the Ebola river and the villagers are calling it Ebola. The international community is waiting for the first declarations of the Dr. Lugasa, responsible for the spread of the illness, and another information from the World Health Organization. They tell me that the press conference is beginning.
Good afternoon, my name is Rochelle Cowan and I am the World Health Organization Communication Director. Today, Dr. Lugasa and Dr. Bouchard are talking to the press about the awful situation that the people of Zaire are living in. Please, the first question. Yes.
Good afternoon, I am Lady Hernandez from Washington Post. My first question is for Dr. Lugasa. Why didn't you not pay attention since the first moment you avoid this case?
At first, I want to make a formal apologize to the international community and especially to the Jambuco people because I committed a mistake, a terrible mistake that it cost their lives to 114 villagers and 11 colleagues. I didn't pay attention to the illness in the first moment because the symptoms were very similar to the malaria or typhoid fever. Just like the journalist Robin Cook proved on his work, this situation is my fault because I didn't fill out the forms to register this situation.
Good afternoon, I'm Lainelis Abreu from Telesur Channel and my first question is for Dr. Lugasa. Do you believe that your decision had a direct influence in the spread of Ebola river illness?
Right now we are living a dramatic situation. We are dealing with the outbreak of an extremely contagious disease. We have found several cases in other geographic regions from Zaire, and we have here some bad news about Sudan too. The migrations between those countries is regular, and it's probably that we are speaking about the same virus. And yes, I think that we can control the illness in our country, and the pathogens is spreading because my wrong decision.
Excuse me, Dr. Lugasa, do you feel guilty about your actions?
Miss, I'm in shame because my actions. I presented my resignation a few days ago, and I'm still here today because I know that the most part of this situation is my fault.
I want to know, Dr. Bouchard, could the illness be avoided not to end up in a pandemic? Thank you.
Well, we discovered that Ebola virus doesn't have cure or any specific treatment. So at the moment, the treatment that we use is to maintain the person alive by resuscitation and to control the hemorrhages as long as is possible. For now, our plan to avoid a pandemic is the immediate diagnosis of the patient isolation. And also we are burning the dead bodies to clean the zone. But there are other measures that depend on the population, like to do the measures of hygiene and to maintain care with the contact with animals like monkeys. We are trying to control the virus and avoid a pandemic. That's why we are isolating the Jambuku virus almost simultaneously at 3 labs. But we presume that this virus is considerably the most deadly microorganism since the bubonic plague.
My second question is for Dr. Bouchard. What is the diagnosis that the international labs can confirm about the illness?
Ebola virus hemorrhagic fever disease in humans begins with an incubation period of 4 to 10 days, which is followed by a broad onset of illness. Fever, headache, weakness, and other flu-like symptoms lead to a rapid deterioration in the condition of the patient. and in severe cases, the disease affects the integrity of the circulatory system. So, individuals with Ebola die as a result of a shock syndrome that usually occurs 6 to 9 days after the onset of symptoms.
For Dr. Cowan, do you consider that the international medical health is important to eliminate the illness?
At this moment, Ebola is affecting to 294 persons in the Yambuku area. That cases had 90% of fatality. Because of that, all the international help is necessary to eliminate this illness. Today, we want to call every country because we need medical support like drugs, medical personnel, and food. Please, people are dying. This is all for today. Thank you very much.
Now, we are outside of the sitting room of the Yambuku Mission Hospital, and we are going to talk with Mariah Taylor, one of the survivors of this incident. Please tell me about the first case of Ebola that you received in this hospital.
We have never had a patient like John. He was the first one and was very complicated for us. John arrived at the hospital believing that he suffered malaria. He had taken chloroquine phosphate because of it. But some days ago, he felt a violent headache, followed in rapid succession by chills, fever, nausea, and diarrhea. The patient has a progressive dehydration. He had vomits with bright red blood and another additional symptoms like a strange rash over his chest. But the diagnosis healed our patients and they increase it every day.
I suppose that you lived a terrible experience with the death of many of your colleagues. How do you feel as one of the survivors?
I feel alive and I am going to do everything for this people. Sorry, that is an emergency and I need to go.
Well, that is all for this breaking news. We are going to continue with another information in the next emission. This is Lisbeth Panin, BBC News.